Okay. All
Hi,
right.
Pooja.
Hello, sir. And first of all, thank you so much for taking out your precious time and squeezing in this small interview with me. Thank you so much. I think on
Pleasure is
behalf
mine.
of
Tell me.
so many mothers and teachers, I would like to extend a very big thank you to you. Sir needs no introduction. Sir is Dr. Karthik Kashyap, MBBS, DMB, Psychiatry, DPM, Psychiatrist, geriatric psychiatrist. Am I right, sir? Did I get that right?
Yeah, no, I think, yeah, I
And,
did my MBBS from Mysore University, my DPM from Manipal, came from Manipal, and from my DNB from the National Board of Examinations. I
and
am basically a psychiatrist. I
sir
deal with
has
neuropsychiatry.
glorious 20 years, 1 years of experience in his field, and he's always rated as the top 3 psychologists in Bangalore,
Thank you.
psychiatrists in
Thank you.
Bangalore.
Thank you.
So it is a pleasure and an honor to talk to you, sir, today. So as we know, like in today's generation, I'm a mother. I'm also an educator. So the various kinds of day-to-day issues that we deal with children. So today we are going to talk a little bit about that and how, as parents and as teachers, we can contribute in the wellness and overall holistic development of children. Okay, my
Yes.
first question is, what are the common mental health problems that children face? Like, say, for example, from toddlers to teenagers. That group is called as the children's group. So, what are the common mental health problems children at this age are facing, according to you?
See, I would like to categorize that based on different age groups also. Initially, at the start itself, you will have problems related to the intellectual development. Okay, IQ, what we talk
Yes,
about.
yes.
So that is actually much visible right from the time of birth, from the early days of birth also.
Yes.
So as soon as, I mean, you have various indications. The child did not cry immediately after birth, or the developmental milestones were delayed. He was speaking very late, or he was walking or talking or recognizing people a bit late, and he was having other difficulties. The mother usually recognizes saying, he is not as like other people, other children of his age.
That is the first impression that a mother would get.
Correct. That is when they usually start discussing with other parents, maybe relatives, somebody who's already had an older child. So my son started speaking at this age. What age was your child speaking at? All this.
Very
No, these are
common.
the these are the situations where the awareness is very, very important.
Okay.
And whenever, as soon as we realize that there is some delay, earlier what they used to say was that we'll just give him time, he'll blossom later. He's like a late flower, he'll blossom later.
Correct.
See, in the current scenario, we are not very happy with waiting. Yes, agreed that there are, I mean, some children do take a longer time, but what I would suggest is seek professional help, let them evaluate. And then let them tell, okay, we'll wait.
Okay.
Because sometimes what happens that the early stages we'll be able to help in a much better way.
Exactly. Yes. Early stages in the sense from at the age of 3, 4, like that. That's what
we start from age 2.
2. Okay.
Two. We start from age 2.
Okay.
Because at that time itself, if we are able to recognize, okay, this is not an IQ problem, it's only a speech problem. This is not an IQ problem, he's only having a gross motor problem. Then we can refer to the appropriate person.
Okay.
Because by the time that the child comes to first standard or second standard, then to recognize, then for the teacher to recognize, yes, the teacher will recognize at that time and tell, but by that time it might already be late. Why do I say it's late?
Lot of time is lost.
Correct. Why do I say it is late? Simple things. See, for example, I'm talking about the same thing about IQ also. I'm talking about the other problems that we can help also.
Yes, that is speech delay and hyperactivity and
correct. I'm just coming to that, but I'm just talking about a timeline here, and that timeline is I would like to handle before the age of 5.
5.
because
Okay.
before the age of 5, yes. Because what happens is that the 2 year to 5 years age group only, if we are able to recognize and if we are able to handle at that level, see, much of the problems might be handled by adequate education or adequate training to the parents as to how to handle him, how
Yes,
very much important.
Yes.
See, if we are able to do that at that age itself, by the time that he comes to formal schooling, like first standard onwards, till that time, informal schooling, that is pre-nursery, it's more about play, play and all that.
Learning, play-based
Play
learning.
learning. So, the only thing that parents or teachers might say is that he is a bit more naughty, he is mischievous. Hyperactivity might not be recognized. Only when we do a proper assessment, then we might be able to recognize. And after the age of 5 years, or when he goes to first standard onwards, then we only want him to, without any breaks, without any slowing, just concentrate on his studies, rather than saying, okay, this is a problem which we need to handle. Or inadvertently, never deliberately, but inadvertently, there will be some kind of a comparison. Why can't you do? Or this child is okay, this child will not do homework.
Subconsciously, yes.
Correct. Now we can prevent that comparison happening.
Okay, that's very insightful. Yes.
So we talked about the IQ part of it. So when there are these developmental delays, these are all indicators that there might be some kind of a, see, when these developmental delays are there, what does it mean? It means basically the brain has not matured as much as it should have.
Okay.
That's a simple thing. Okay. Now, if the body is growing and the brain is not growing in relation to that, that is when we talk about the, now the IQ, what we talk about, intelligence quotient, is basically a fraction of mental age over chronological age into 100 of the healthy way. Okay. So basically we are trying to assess the percentage of how much his brain development has happened compared to his physical development. That comes as a IQ. We talk about a number. It is usually one whole number. We don't talk as percentage or whatever. It is a whole number.
It's a whole number.
IQ is 56, IQ is 96. It's like that.
Okay.
So
and
this is in relation to the IQ.
Yes. What if the child? What is the average IQ for, say, for example, 3-year-old child? What should be the IQ for a 3-year-old child?
3-year-old or any IQ, we usually talk about 90 to 110 being the normal.
Normal IQ. Okay.
90 to 110 is the average IQ, normal IQ, so less than 90, we talk about there is some kind of a deficiency. And yes, we talk about borderline intelligence, mild, moderate, severe, profound, all these levels of. Earlier, we used to call it as mental retardation. Now we call it as IDD, intellectual development disability.
Okay.
So,
and this can be overcome by the children? Can they outgrow this?
See, that is a tricky question. See, can somebody outgrow an IQ of 56? Possibly no. But if somebody has an IQ of, let's say, 89, with adequate training, with let's say concentration enhancement, memory retraining, can they actually start functioning in their way that they can actually take care of themselves? Possibly, yes.
Yeah. Okay. And also, there are some children who have learning difficulties or learning problems.
Correct.
Okay, no matter whatever you teach, how much ever you teach, it is so hard for them to process and understand and learn. So where do these category of children fall?
See, this is a very, very important category. Now, the previous generation, what used to happen is that they would have common examples like, my son is always scoring 95 in all subjects except maths. Maths, he doesn't go above 60.
Yes.
Commonest example. Yes. Example. This is exactly what learning disability is all about. Okay. So learning disability, we talk about where IQ is fine. So when teachers actually refer children to us for assessments, and parents come and say, my child is not retarded, why is she being referred over here? So this is the difficulty with the understanding. This is where we need a better awareness. Nobody is calling anybody as retarded. It is because they are having a specific disability related to learning. Okay. Because we all want our children to achieve there. If they are having a difficulty to reach, That
Yes.
difficulty, we need to take it out.
Yes. Yes. Yes.
Okay. Now, here is where I want to make sure, I want to be clear that the IQ will be fine.
Mm-hmm.
IQ is fine. They are able to do all that. They say he is able to recognize what car this is. He is able to draw so well. No, we are not contesting that. The only
Mm-hmm.
difficulty is he is able to reach here in all subjects except for this particular subject. So that is a
Yes.
specific disability that we are talking about. And with
Oh.
adequate training, that also can improve.
So, yes. Okay.
Because in the earlier generation, what they used to they used to say is that whatever he is able to study, let him study. Just force
Mm-hmm.
better. If he is not able to study something, just leave it. My
Yes.
question is, can we leave it? Can we leave it? Because here we all want our children to score very well in all subjects.
Yes. Exactly.
So if, and in PUC level, you know that if there is a 1 mark difference,
Oh,
so many
yes.
ranks drop off.
Definitely. Yes. Yes.
So in this scenario, if somebody is scoring only 60, that means 40 marks is gone there only.
Yeah. 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 True.
So it becomes important that we need to identify why he is not able to score and give him the adequate training so that there also he is able to do better.
Okay. And
Rather than only saying whatever you are able to do, you do it.
that I don't think so. That is the attitude of today's parents or teachers, because most
No,
of the
no, they
parents,
all want to score, but
they
the
all want to.
difficulty is, yeah, unless we identify this, then it becomes difficult. That is
Ha.
where
Yes.
awareness comes in.
Yes. Yes. So there is also a lot of stigma related to mental health of children. Parents are mostly in denial. They do not accept. They make it their own problem. They're not thinking
Correct.
about the child having the problem. They make it their own, that it is their, they're not successful enough to raise a child in a certain way and all. So because of that, there is a lot of stigma. So what is your message to parents like that, who are in denial, who are not accepting this situation of their child, and how damaging it is for their children?
See, this is again very, very important. See, I have so many parents who get their children and doctor, he's outside. He doesn't know that I've brought him here for that. So I told him it's for me. So just like you are seeing me, you see him also. No, this is a very, very wrong way of handling things, because the very first time that I'm seeing the child, if that first consultation is based on mistrust, if it's based on lie, saying the consultation was not for mummy, it was actually for him, then how do I ensure 100% cooperation from him later?
True.
On the other hand, this year I've had so many 7th standard and 8th standard kids who were able to recognize that they needed help.
Okay.
They researched, they went
Okay.
through all the articles, they went through my
Okay.
reviews, and then they said, they told the parents, Daddy, I want counseling. I want it by Dr. Karthik, and this is the appointment
Oh.
number. You please call this and take an appointment. This
Oh,
is 7th
that's
standard, 8th standard kids I'm talking about.
wow, super.
But what the parents do? Parents said, I've given you a room, I've given you a laptop, you just sit and study, you don't require anything else.
That is
And I've had parents who came and told me that he was telling me from past 8-9 months, but I kept on trying to postpone it in any way. But ivaga anivarya anta, without any options, I will come over here.
it is sad.
So then, yes, that is where though. So we talk about stigma, then let us talk about awareness over here. That is where awareness needs to come.
Okay, that is very, very important. So even
Just
whomever
like, I mean, if I have a sprain, I go to an orthopedician. If I have fever, I go to a physician or a pediatrician. If it is a child, if I have some ear problems, I'll go to the ENT. Just like that, brain is essentially an integral part of the same body. And if I am having any issues over there, I should not hesitate to seek help. This is
yes,
exactly the same thing that I will
it
tell
is
again
just
and
that
again.
getting a wound healed on your body. It is very, very
Correct. Same thing.
And small children, especially these days, I think every one child, in every 10 children, one child is definitely having a speech delay, or definitely having, some, they are very, very hyperactive. So how do we recognize that, okay, this child needs certain assessments? This child, has to go through certain assessment, because parents are constantly waiting for them to achieve milestone. They are not doing anything about it. I have seen in my own experience so many people like boy no ಹುಡುಗ ಅಲ್ವಾ ಸ್ವಲ್ಪ ಲೇಟ್ ಆಗಿ ಮಾತಾಡ್ತಾನೆ ಪರವಾಗಿಲ್ಲ. So that attitude, keeps going for a really long time, and then the time is lost. So what is actually like speech delay, autism, how they are interconnected, what is hyperactivity, ADHD, all these, how they are correlated, and especially these are seen in the smaller age group children more than the higher age group children.
See, okay, these are seen in the smaller age group children for the simple reason that the amount of dysfunction, disability is so much that the parents or anybody will actually recognize. As simple as that.
Okay.
It can be seen in adults also. Autism or hyperactivity can be seen in adults also. Adult ADHD is also well recognized concept, and we definitely help them out also. Coming to the questions, I'll try to take them one by one. See, autism is where we talk about certain characteristics where they have a difficulty with social communication, with their repetitive movements that we talk about. So you will have some children going like this, or
repetitive movements.
Yes, we call them stereotype movements. So either this social communication and this lack of an emotional connect is very, very important in autism. So what does it mean? See, for example, you would expect a small child to become very anxious if the mother goes away, or if some stranger comes and picks it up. Here, that kind of an emotional, reaction like an anxiety or fear might not be there. You might have a mother who is working, who comes home, and you will see that the child is running, mommy, mommy, and hugging and kissing and all that. That kind of an emotional connect might not be there.
Okay.
So that is also possible in autism. So in autism, there are varying, autism is actually one broad category wherein we have various subtypes. Yes, we have various subtypes also. And we have to understand one thing: autism can be with low IQ, can be with normal IQ, can be with higher IQ also.
Okay.
So autism doesn't necessarily mean it's low IQ. Be clear on that. Okay. So autism can be with normal or higher IQ, also high functioning autism and healthy. So they'll take up one part of it. Like for example, they might become mathematical geniuses, but they might not have a way of communicating with other people.
True.
So these kind of difficulties also will be there. So this I'm just able to give a very short brief right now.
Because it's a very big thing, very big spectrum, and each child is different. Each child's needs are different.
True.
And each child's response to these things are different. So it's a very big
next
spectrum.
coming to hyperactivity and ADHD are linked to each other. See, what is hyperactivity? The body movements are so much more that they are unable to control it. So basically, what does it mean? That they are just all over the place, running around, climbing the window, sitting on my table, trying to grab my laptop and running away. All this is seen even in the clinical situations. In the class, what happens is the teacher will might always notice that the child is never in his seat. He's always walking about. Or mother might notice that even if he just sits also, he can't sit. He has to keep doing something or the other. He has to keep doing. I can't even sit straightly and even watch the TV also. He is always on the move.
Correct. Exactly.
They might eat very less. They might sleep very less, but they are still seen with a lot of energy. Yes, people keep wondering, he never gets tired. He does not eating properly. He keeps running around everywhere, but he's still never tired. I am trying to run behind him. I am tired, but he is never out of energy. He is always running, jumping, doing a lot of things. So that is a hyperactivity that we're talking about. Simple mischievous things that are like a child is running and playing with other children is perfectly fine. But when it is so difficult that it is actually the family is having a difficulty controlling him, he definitely requires care. Now, this is hyperactivity. The ADHD that you talked about is very much linked to hyperactivity. It is attention deficit hyperactivity disorder.
Yes.
So here we have actually three components. One is the attention deficit, or what we call as the inattention. That is the concentration difficulties we have. Then we have the hyperactivity.
Hmm.
Okay, that means the increased activity levels.
Hmm.
Then we have impulsivity also. What is impulsivity? Nodadilla, sudden ಓಡ್ತಿರ್ತಾನೆ, he keeps falling down, but again he is never hurt, he keeps running again, or he tries to answer before the question is completed.
Yes.
He
Yes.
is in a big hurry to run away from the exam also. He'll just write whatever it's there and he'll run away.
Correct.
Or making silly mistakes like plus minus ಆಗ್ಬಿಡ್ತಾನೆ, minus plus ಆಗ್ತಾನೆ. Simple things like this. So when you ask him, he tells properly at home, because at home we give them clues. Hey, 4 or 6 are correct. So then he is able to correct himself. But when he goes for exams, then he makes these mistakes. And if you notice the question paper, it's a lot of these so-called silly mistakes.
Correct.
So he knows what it is to be written, but he makes those small mistakes.
Yes.
Okay.
Yes.
So this is what ADHD is all about. And yeah, you asked about speech delay also. Now, speech delay is something which is again a big topic, because speech delay can happen due to the intelligence not being proper also. It can happen due to difficulties in the mouth oral area also. Like for example, there is a tongue tie, he is not able to speak properly, or there's a some kind of a difficulty in the speaking apparatus. Okay. I'm just trying to use simpler words. So the oral musculature, where how you speak, able to speak. For example, some people might have a cleft lip ಅಂತ ಹೇಳ್ತೀವಿ, ಅಂದ್ರೆ there will be a gap in the lip, or gap in the palate upstairs. So avaglu they have some kind of a speaking difficulties. Okay. All this also might be there, so it requires a proper assessment. Okay. If it is related to the IQ part of it, yes, then we might be the people to see. Otherwise, a speech pathologist or a speech therapist, they'll be able to help better. They might usually be seen with ENT people, so those might be the people to address. But commonly these days, what I'm observing is brain is fine, the oral apparatus is fine, but child is not speaking. That is a very, very common thing which I'm seeing right now, and that is because of lack of stimulation from the family. See, earlier what used to happen is that, okay, idenidu pen, tell me, okay, this is pen, okay, idu pen alli en ಮಾಡ್ತೀವಿ, we will write. We used to teach. Now what has happened is that people are so busy that the child is usually in front of a TV or the laptop or a tab or whatever. So he only hears, he doesn't repeat.
Yes.
Okay. So earlier what used to happen, whenever the child used to child used to being fed, you would have the mother or the grandmother singing a song, telling a poem or telling a story and say, avatೇನಾಯ್ತು ರಾಜ ಏನ್ ಮಾಡ್ದ, ಆಪಲ್ ಕೊಟ್ಟ, ಇನ್ನೊಂದು ತಿರ್ಗ ಹೇಳು, ರಾಜ ಏನ್ ಮಾಡ್ದ, ಏನ್ ಕೊಟ್ಟ, ಆಪಲ್, ಹೇಳು ಆಪಲ್. ಓಕೆ, ಆಪಲ್ ಹಿಂಗಿರುತ್ತೆ, ರೆಡ್ ಇರುತ್ತೆ, what is this? This is an apple. So that learning was happening. Now that learning is not happening.
Yes.
Especially in the past 2 years, people have been in front of screens only.
Yes. True.
In a different room. Don't disturb me, you see your TV, you see a cartoon. So there, that kind of a learning is not happening. So when we do the assessments, everything might be normal, but child is not speaking. So it just means basically that he needs to be taught, he needs to be engaged, he needs to be stimulated. Take them out, let them mix with other children, speak, you speak to the child, you spend time with the child, then things might start happening slowly. Sometimes what happens is that, for example, let's say that somebody has come from, let's say, Bengal, and they have come to Karnataka. And the parents, because of the work difficulties, work pressures, they talk in English. Now what's happening? The child is exposed to a lot of different languages, which is not able to pick up suddenly.
Correct.
So if he is taught one after the other, he might learn all 3 languages. But suddenly the child is not able to pick up neither Bengali nor Karnataka, Kannada, nor Hindi, nor English. So that also becomes an issue. So we'll have to go slow during the learning phase.
Okay. I got
So
it.
all these might be leading to speech difficulties.
Mm-hmm. Okay. Yes, that and many people have asked me, and that is there in my mind also. Is autism genetic? Is it genetic?
Autism definitely has a hereditary component. It
Okay.
definitely has a hereditary component, but none of those problems are one is to one. It's not 100% transmissible. It's like, is diabetes genetic? Yes, definitely it is hereditary. And if the father or the grandfather had, then there's a more risk that this person would have.
Mm-hmm.
But is it 100% transmissible? Then that means if the father had, let's say, autism or schizophrenia, whatever, then the child has to have. That kind
Mm-hmm.
of a one is to one is not there.
Okay. Okay. It is not directly linked, but
It's
maybe
not one is to one. It is
it's
not one
not
is to
one.
one.
It's
So
like
hereditary
blood
component is
sugar,
definitely there.
like
Correct. Correct. The transmission is definitely there. Hereditary component is definitely there, but it is not one is to one.
okay. So one more thing which I read when I was doing a little bit of reading on
Hmm.
this is that children are given vaccination, right, when they are
Hmm.
toddlers. So sometimes what happens is these kind of vaccinations which they are given, do they have any component or anything that would affect this autism or these kind of developmental delays?
So would vaccines cause autism?
No, I'm asking because exposure
No,
to
no, no.
okay.
See, cold season is linked to some of the influenza and that causing some kind of a lesions in the brain and all that. So there are some kind of a viruses which cause. Uh, there are some vaccines which are killed vaccines. I mean, the virus or the pathogen. I mean, we can have it two ways. One is only the protein. One is a killed pathogen and all that. Sometimes some kind of an allergic reaction can happen. Some kind of a difficult situation can happen. But do vaccines cause these problems? No, because if they were causing, they would not be out over there, and pediatricians would not be giving it. As simple as that.
Okay, fine. And any latest development happening in this field which can fasten the progress of children or anything medically, anything is happening?
See, the most important
That
thing that is happening is proper assessments. Now, in several
okay.
situations, assessments don't happen and they are not recognized, and possibly proper treatment is not available. That is one
Mm-hmm.
thing. Assessments are very important, and I would suggest that people take use of that. Now,
Okay.
regarding your question about hereditary and genetic component, there are some places which do genetic testing also, where you
Okay.
can actually find out if the parents can actually find out if the child that is going to be born, the unborn child, does it have a risk of going into autism, schizophrenia, and all that
Oh.
also. That kind of a
Oh.
genetic testing is there. So whether the IQ would be normal, whether, I mean, of course, they are not 100%, but definitely it is a step in the right direction. So that
Okay.
kind of a testing is also started. It's not widely available, but it is there. It is there.
Okay. So one last message to parents and teachers from your side.
The best thing that I would say is that awareness is very, very important. And if at all there is any doubt that there is some kind of a delay or some excess activity, hyperactivity, or he is not able to study well, concentration, if it is poor, memory, if it is poor, whatever, please don't hesitate. The brain and the mind is something which is very much part of the same body. Mind is something which helps somebody in education. Mind helps somebody to get a job, to maintain a job, helps in relationships and all this. I don't think we should have any kind of stigma to say that no, no, for other things we can go and show, but for the mind we should not show. So I don't think we should have any kind of stigma for that.
Yes.
If there is no issue, I'll tell you, okay, there's no issue, you can go back. As simple as that.
Yes.
So go ahead. I
That's
think we should come out of this, and child mental health problems are mostly they can be handled, and at a very early age, it is very, very important that we recognize and handle at an early age.
okay. So children who are having mild issues, if you can say we can very well say that they will outgrow that phase.
Usually, yes. But see, if somebody is having IQ related problems, autism and
IQ
learning, when you
related
have a hereditary
problems.
component, that becomes difficult. But most of the other, like for example, learning difficulties, hyperactivity, and all that, yes, they can be controlled.
Okay. Okay. And
And
thank you.
one more thing that I want to tell you is, even if at all medicines are used, those medicines are safe in children. They are not lifelong. They need not be given lifelong. We will be stopping it. Medicines might
Medication
be
for
given so that, yeah,
ADHD
so
and
that they can be trained better. Yeah, they can be trained better. The training
medications for
therapies will be
medications for
hyperactivity. How?
ADHD,
Behavioral
ASD,
control. See, for example,
behavioral
even
control. How?
autism, you will see some children who become very violent towards themselves. Also, they start biting
Yes.
themselves. They start biting other people. All that. So, for that kind of a behavioral control, also it can be used.
Okay. Okay. So we should not be scared of medications. Definitely, there's a
True, true,
lot
true.
of research gone into making those medications,
Exactly,
and
exactly,
hence
exactly.
we should make use of them if need be. Right? That's what you are saying.
Correct, correct, correct.
Thank you so much for this precious time that you have given me, and so many people are going to be benefited by this. It's really an honor to talk to you, and if there is a demand, then we can do round two of the interview with many more other questions also. Right? Thank you so much, sir.
Definitely, definitely.
Thank you so much.
Thanks, Pooja. Thank
Thank
you so
you.
much. Thank you.
Thank
Thank
you.
you. Thank you.
Bye.
Thank you.
Bye.
Bye. Bye. Bye.
Okay, so this is a brief about this very few questions and very few discussions have happened. It's still a long topic to be discussed. So if you have any questions, any doubts, or anything regarding this matter related to children, behavioral issues, or speech delay, autism, hyperactivity, anything, please do post in the comment section, or you can actually contact Dr. Karthik Kashyap. If you Google him, you will get more details about him, and can do, get more details about it. Thank you so much.